All right, so today we're going to be doing a deep dive into something pretty wild. Treating hyperthyroidism in cats with radioactive iodine.
Yeah, sounds a little sci-fi, doesn't it?
It really does, but apparently it's a pretty effective treatment. We're going to be looking at some research from a veterinary specialist, Dr. Mark E. Peterson.
He's done some fascinating work in this area.
Yeah, so I was reading through his research, and it's pretty amazing. Basically, you give a cat one injection of radioactive iodine, specifically iodine-131, and it kind of just like zaps the problem away.
It's pretty close to that, yeah.
Wow.
So the way it works is I-131 acts a lot like regular iodine, the stuff that the thyroid gland naturally absorbs.
Right.
But the radioactive part is what makes it so effective. It emits these little particles called beta particles, and they basically target those overactive thyroid cells.
So it's like a microscopic seek and destroy mission happening inside the cat's thyroid.
Exactly, and that's why it's considered a permanent cure.
That's incredible. So compared to like daily medication or even surgery, this just seems so much easier.
Oh, definitely. It's a big relief for both the cats and the owners.
Yeah, I can imagine.
I mean, think about it. Giving a cat a pill every day, it can be a real struggle.
I can only imagine.
And then there's surgery, which always has risks, especially for older cats or cats with other health problems.
And speaking of other health problems, our sources mention a few cases where radioactive iodine is particularly helpful.
Right. So, for instance, if a cat has what's called an ectopic thyroid tumor, meaning the tumor's actually outside the thyroid gland, trying to remove that surgically can be really difficult.
And what about those tumors that are located inside the chest cavity, those intrathoracic tumors?
Those are even trickier. Yeah, surgery in that area is very complicated.
Wow.
And then, of course, there's the most serious case, invasive or metastatic thyroid carcinoma, which is basically thyroid cancer that has spread.
Oh, wow.
And the amazing thing is radioiodine can actually target those cancerous cells throughout the body.
That is incredible.
Yeah.
It's a pretty remarkable treatment. Okay, so I'm definitely seeing why this treatment is becoming so popular. But I have to be honest, the word radioactive still kind of freaks me out.
I understand that.
So is it actually safe for the cat and for the owners?
Yeah, that's a great question. Safety is definitely the top priority. So, yes, cats who undergo this treatment are radioactive for a few weeks afterwards.
Okay.
And that's why they need to stay in a specialized facility where they can be monitored.
So no cuddling with your kitty right after treatment?
Unfortunately not, no. And it's not just direct contact. Their waste is radioactive too.
Oh, wow.
Yeah, so that's why those guidelines for owners are so important.
So let's talk about those. What precautions do people need to take at home?
Well, for the first few weeks, it's all about minimizing close contact. So no sleeping with the cat, keeping them indoors.
Right.
And it's especially important for pregnant women and children to avoid contact with the cat.
Oh, for sure.
And when it comes to like cleaning up after the cat,
Okay.
gloves are absolutely essential. Use them when handling litter or cleaning up any accidents. And of course, thorough hand washing afterwards is a must.
Right, that makes sense.
So being informed and following those guidelines is key to keeping everyone safe.
Okay, good to know. I'm also curious about the vets and nurses who work with these cats. Are they at risk?
That's a great question. And yeah, they take precautions too. They wear protective gear and they carefully monitor their own radiation exposure.
So it's a pretty specialized field.
It is.
Which brings us to another really important aspect, getting the dosage right. It seems like there's a fine line between effectively treating the hyperthyroidism and actually causing new problems.
Yeah, you're absolutely right. Historically, vets used fixed dose or variable dose methods based on the cat's symptoms.
Okay.
But those methods often led to a complication called iatrogenic hyperthyroidism.
Wait, so the treatment itself could cause hyperthyroidism?
Yeah, it's kind of ironic.
That's wild.
It is, and that's exactly why Dr. Peterson's research is so significant. He developed a dosing algorithm that's all about personalization.
Okay, I'm all ears. Tell me more about this algorithm.
So instead of just relying on a cat's symptoms, this algorithm uses a bunch of objective measures, like we're talking about things like the cat's serum thyroid hormone levels, the actual size of the tumor, and even something called percent uptake of pertechnetate, or TCTU.
TCTU. Now, in plain English, what does that tell us?
So basically, it's a way to measure how much of the radioactive material the thyroid is absorbing.
Okay.
And by factoring that in, along with those other measurements, vets can figure out the absolute lowest but still effective dose of I-131.
Wow, so it's like a custom-tailored treatment plan for each cat.
Exactly.
That's amazing, but how do we know it actually works? Did Dr. Peterson test this algorithm out?
He did, and the results are super promising. His study involved a whopping 1,400 cats.
Wow, that's a huge sample size.
It is.
All right, so hit me with the study highlights. What did they find?
Well, first off, the algorithm was incredibly effective. Almost 75% of the cats in the study, to be exact. It was 74.8% achieved what we call euthyroidism, meaning their thyroid function returned to normal.
So essentially they were cured.
Exactly.
That's amazing. But what about that risk of hypothyroidism we talked about? Did the algorithm reduce that?
It did. Only 4.1% of the cats developed overt hypothyroidism, which is significantly lower than with those older dosing methods.
Okay, so that's a huge win for the cats and for their owners.
It is.
But I'm curious, what about the other 25% of cats who didn't achieve normal thyroid function after the treatment? What happened to them?
That's a great question. So, a portion of them, about 17.1% to be precise, developed what's called subclinical hypothyroidism.
Okay,
This means that their thyroid function wasn't completely normal, but it wasn't severely low either.
so their blood work might show some subtle signs of hypothyroidism, but they wouldn't necessarily have obvious symptoms.
Exactly. It's a bit of a tricky situation because it might not be immediately apparent, but it still needs to be monitored and potentially treated.
Right, so it's not a perfect solution, but it's definitely a step in the right direction.
Definitely.
Is there anything else about this algorithm we should know?
Well, there's one more thing we need to address, the connection between hyperthyroidism and kidney disease. It's a bit concerning, but important to understand.
So we were just talking about this connection between hypothyroidism and kidney disease in cats.
Right.
And, it's definitely something I'd want to know more about if my own cat was facing this treatment.
Sure.
Is there any way to kind of predict which cats might be more prone to these complications?
Well, that's the million-dollar question, isn't it?
Yeah.
And unfortunately, there's no easy answer, no crystal ball.
Right.
But research is starting to point to some potential risk factors. We talked about the different dosing methods earlier, like the fixed dose, the variable dose, and then Dr. Peterson's individualized algorithm.
Right. It seems like that personalized approach is so important.
It really is. And, cats who were treated with those older, higher dose methods, they might be at greater risk for developing hypothyroidism and then subsequently those kidney issues.
Okay.
So Dr. Peterson's algorithm, with its focus on that just right dosage, it really seems to be a game changer for minimizing these risks.
So it's like the Goldilocks approach to treatment.
Exactly.
I like that.
Find that sweet spot.
Yeah, for sure. I want to shift gears for a minute and talk about the actual experience for the cat.
Okay.
What's it like for them, during and after the treatment? I know they have to stay at the facility, but what does that actually involve?
Yeah, so it's actually less traumatic than you might think.
Okay,
The cat gets the I-131 injection, which is really no different from any other routine shot.
right.
And then they basically just hang out in a special isolation ward for a few days.
Okay.
And this isn't because they're feeling super sick or anything. It's really just to allow the radiation levels to decrease and to ensure everyone's safety.
So it's more about precaution than the cat being really ill.
Exactly.
Okay, so what happens when they go home? What should owners be aware of?
Well, once the radiation levels are down to a safe level, they can head back home. And of course, those safety guidelines we talked about earlier are crucial for the first few weeks.
Right, of course.
But the cat itself can pretty much go back to their normal routine.
Okay, that's reassuring. Are there any common side effects after they return home that owners should watch out for?
Most cats don't experience any major side effects. You might notice a little lethargy or maybe a decrease in appetite for a few days.
Okay.
But that's usually about it. The bigger concern, as we've discussed, is that potential for hypothyroidism developing, weeks or even months later.
Right.
And that's why those regular checkups and blood tests are so important.
So how often should owners be bringing their cats back to the vet after the treatment?
Well, generally, a recheck appointment about a month after treatment is a good starting point.
Okay.
And then from there, the frequency of follow-up visits will really depend on the cat's individual situation and those blood test results. It might be every few months or it could be annually.
Okay, and I'm assuming those follow-up appointments would include blood work to check both thyroid and kidney function.
Absolutely. We want to stay on top of any potential long-term complications.
Right.
And the good news is that if hypothyroidism is detected, treatment with thyroid hormone replacement medication is usually very effective.
Okay.
Most cats respond really well and go on to live happy, healthy life.
That's great to hear. We've covered so much ground in this deep dive, but there's one more thing I think we need to address, and that's the cost.
Okay.
From what I've seen, radioiodine therapy can be a bit pricier upfront compared to medication or surgery.
Yeah, you're right. The initial costs can be higher.
Okay.
But it's important to look at the bigger picture. Think of it as an investment.
Okay.
With radioiodine, you're paying for a one-time treatment that has the potential to cure the hyperthyroidism completely.
Right.
So you're not dealing with the ongoing costs of those daily meds or the possibility of additional procedures if surgery doesn't completely resolve the problem.
So it could actually save money in the long run.
It definitely could. And that's not even factoring in the reduced stress for both the cat and the owner, no more pill battles, or the worry of surgical recovery.
Yeah, those are definitely important factors to weigh. It sounds like this treatment has the potential to be truly life-changing for some cats.
It can be. And, we focus a lot on the science, the risks, the benefits, even the cost.
Right.
But there's another important layer to this whole story that we haven't really touched on yet, and that's the emotional.